Hey everybody, welcome back to TapRooT TV. I'm Benna Hughes, and today we're going to talk about a topic that affects everyone, and that is healthcare. We do work in so many different industries, but this is the one that really hits home for every single person out there, and we are so excited because we have with us, you've been here how long?
Probably since May, so it's going on almost 6 months.
It's the debut of Marcus Miller on TapRooT TV, and we are so happy to have him because your background is in healthcare.
It is.
Tell us about that.
So I was over operations for a therapy company, and it's not just this company, it's all the healthcare organizations out there, or most of them. They really don't know how to do true root cause analysis. There's a lot to learn from the industries that TapRooT normally works with, the mining, the really dangerous oil and gas, heavily regulated. Those guys have got it figured out. They do really well when accidents happen. They know how to fix the real root cause and not blame people. And I think healthcare is still at that stage where if something goes wrong, we like to look at who did what and decide how we need to fix that person and not necessarily fix the root cause of the issue.
Well, it's always such an emotional issue when something goes wrong in healthcare. You have people, they need an answer and they need it fast. And the hospitals, there's so many things involved with funding, and so many lawyers are involved and so many things that it's easy to point fingers to try to get to an answer.
That's exactly right. That's the key. It's really easy to just say, okay, well, we dealt with the person by removing them from the situation, so we're not going to have to worry about this again. But the next person that comes in, the same systems are there, the same processes are there, and they're going to be set up for failure as well.
It was just a couple of months ago, I think Mark Paradise and Ken Reed and I were talking about human factor engineering. And in healthcare, that's a really big deal because of labeling, because of maybe how a piece of equipment is set up. Can the person see it? So there's, the healthcare professionals are there to help us. And that's all they want to do is help us and not harm us, but they're humans.
That's right, and they need systems and processes that help support them and not have us think that the people are the problem.
Not blame.
That's
right. And sometimes it's out of their it's time pressures. There's just so many things.
Oh, there's so many overwhelming things.
There's
there's so many fires to put out, and patients need things at the same time sometimes. It's not real easy to go from patient to patient to patient and have a nice, easy, scheduled day. Sometimes people need things at the same time, and healthcare providers, they have to make choices on their resources.
They're pulled thin.
And that's when mistakes happen.
Yeah, it does. So recently in the news, there was about an incident that occurred.
Oh, tragic. Yeah,
so, very sad.
And that's in current news right now. You can look it up. But Vanderbilt did have Vanderbilt Medical Center. They did have a patient that expired because they got the wrong medication.
Right. And it should have been a routine situation.
Yeah, the patient was going for a PET scan and they were claustrophobic, so they spoke up for themselves and said, hey, I'd like to get a little bit from medicine for my anxiety. The physician said no problem, prescribed the medicine. There's a nurse that was responsible for the patient. She was busy, so she couldn't get it done. So she asked an all-help nurse to get the medication, take it to the patient, administer it, and that's what she did. So this poor nurse that was the help all. It was a position that didn't have a job description, wasn't really trained. This poor nurse had a orientee with her that day that she was assigned.
Multitasking and trying to figure everything out at the same time.
She was already on her way to another procedure.
Yeah.
So she was trying to get it squeezed in, and she took a shortcut when she was taking the medicine out of the cabinet, which was ridiculously easy to do.
Right.
And she ended up giving this patient, instead of the anxiety medicine, a medicine that causes paralysis.
Right.
And then the patient was left alone waiting for the scan. So after the patient had the medicine, it slowly starts to paralyze you to the point where your diaphragm doesn't work, and then you can't get air into your lungs, and the whole time the patient's aware of what's going on, and they can't do anything about it.
That's
just there's so many opportunities.
Oh my gosh, that's so scary.
So there's a lot of room for improvement there. The silver lining is there's so many areas that we can find the root cause of and fix, so they don't have to deal with that again. But I'm not encouraged with the statement Vanderbilt put out, because it basically said our staff took shortcuts and we made the appropriate personnel changes.
And somewhere in there's, as we were talking about, a lot of times healthcare professionals being pulled in so many directions or things like that, that's not necessarily, their fault. They're just they're under a ton of pressure. And so to place blame in those areas, there's something else underlying there somewhere that probably could have been fixed. It needs to be investigated and looked at.
There's multiple opportunities for improvement there. And it's not just Vanderbilt. I mean, it's in a lot of healthcare organizations where we're
absolutely.
Just trying to get to the next fire. And,
yeah.
It's really easy to blame and to fix it by removing people.
Well, Marcus and I were talking a little bit before this started, and I was talking about a couple of experiences I've had that it makes me, you've kind of got to be your own healthcare advocate and be your own safeguard when you're in the hospital or at a doctor's office and they're getting ready to inject you with something. I always will go, so what are you giving me? To make them stop and maybe hopefully think twice, maybe do a little quick double check, and how much are you giving me, to make sure, it makes me feel better to know that they've thought about it a second time. And
anytime you can slow them down.
Exactly.
And everybody, even at our jobs, which, we're not, saving lives at our desk, but these healthcare professionals are saving lives all the time. And anytime, and they're always thinking about the next thing they have to do as well, because they're just trying to keep their company happy, they're trying to stay on schedule. And anytime you can slow them down, it's probably a good thing. So they have time to kind of reflect on what they're doing in the moment and make sure they don't make a mistake with you. Right.
And I mean, just things like that, just asking questions. Don't be afraid to ask them questions. If you're not in the position to ask the questions, have a family member there that can ask the questions. I was telling him about when I was an event that happened to me in the hospital where I was by myself after surgery, and it was time to, they came around to give me my nighttime injection of pain medicine, and she gives it to me and jets out the door, and I got to where I was having a hard time breathing, and I was like, just having to focus to keep myself breathing, and I called the nurse's station, and she says, I'll tell your nurse, and no one ever came. And I was by myself, so it was like, thank goodness it passed, but they were stretched thin. Yeah. They did not have enough staffing going on.
Yeah, they're not sitting back there reading a novel and just not coming. There's probably a legitimate reason or somebody they were helping that caused them not to get to you.
And they'd give me the medicine once before, and I didn't have a reaction, so there was probably no reason for her to think that I would have one. But so the next nurse comes in and I tell her about it. Thank goodness I was still alive. I tell her about it, and she goes, she probably just injected a little quickly. So she did it slower, and she was correct. I didn't have a problem that time, but they were in a hurry.
Yeah, you have to be an advocate for yourself.
Well, what can TapRooT do to help?
So my goal is to introduce TapRooT to healthcare organizations so they know there's a better, more consistent way to handle problems. And we do that, or we're starting to do that through a newsletter. It's brand new that we started just for the healthcare industry. I'm really proud of that.
Great.
Barb Carr has been excellent. I couldn't have done it without her.
We can't do anything without Barb.
It's amazing how much she knows. Also, she helped me put together a blog, so we're blogging. But what I'm really proud of is we're working with Ken Turnbull to put together a specific TapRooT course that comes with its own textbook and its own dictionary that's geared towards the medical field.
Yes.
So we've got the textbook done. The dictionary's at the printers.
Oh, that's good news.
And we're just about to market TapRoot's specific patient safety course.
That is so good to hear. Well, we're so glad you're here. We have worked with a lot of medical professionals in the past, some for many, many years, and we want to work with more. We want to do what we can to help keep patient safety keep everybody from having these hospitals and stuff from having sentinel events and just keeping everybody safe. This is, like we said, one that affects every person out there. Nobody's exempt from having to.
Everybody's going to need health
Everybody has to have
at some
it.
point.
And you know, we appreciate the people out there who give their lives to that industry. So we want to help them be successful.
And if you truly follow the TapRooT process and you fix the root causes, you are saving lives.
You are.
You're saving lives and preventing these unnecessary deaths. That is something to be very, very proud of.
Well, and unnecessarily, you know, firing someone.
And not messing
you know,
up people's lives.
Right.
For mistakes that we all make.
We
when
do.
We're under pressure.
No one would want me as a nurse. That's all I can say. It wouldn't be because I wanted to not be great at it, but, you know.
Now, we do have a client, a healthcare client, that does a really great job. Military health system we've worked with for a long time. Ken Turnbull, Dana Roca, from their side have come together, put together a course for the military. They use TapRooT in all their clinics around the world, and they do a spectacular job taking care of issues when they happen.
Oh, we love that.
Yeah.
Well, we want to help more of you, and we can do that. All you have to do, I mean, feel free to contact Marcus directly.
Absolutely.
How can they contact you?
Marcus.miller@taproot.com.
And just or just info@taproot.com, and we'll get you to Marcus, and he can help you. We want to, I mean, our regular TapRooT courses are beneficial, but the medical ones, are those going to be public, or are those going to be all on site?
No, we'll do both. We're
good.
hoping to schedule, if we see a good response, schedule some publics, get people interested, just to give healthcare organizations a chance to kind of put their toe in the water, send some people, see what they think, and gain some traction in the organization.
It's a great
people
idea.
Coming back. And then that'll lead to healthcare organizations saying, hey, this is a really good system. Let's get them in and start getting all our people trained.
It's a great idea.
Yep.
All right. Well, if you want to know more, contact us at info@taproot.com or contact Marcus and call us 865-539-2139. Please follow us on all of our social media platforms. You'll be able to go on our website too and see the blog articles he's talking about. You want to make sure you get our newsletters. The way you do that is on our website. There are places throughout the website that lets you sign up for our newsletters so you can stay up to date. Is there anything special they need to do to get the healthcare newsletter?
Probably the easiest thing to do is email me at marcus.miller@taproot.com, and I can make sure that you get on our mailing list.
All right. Well, Marcus, great debut.
Oh, well, thank you. Not nervous at all.
You did wonderful. Well, thank you for joining us, everyone, and we hope to see you back here next week. Bye-bye.
Bye-bye.